Avenue Optical Inc., located at 200 County Court Boulevard, Brampton, Ontario. Phone number is 905-454-1277. So, who are we? We are an optical store regulated under the Ontario healthcare system. We are all professional and friendly staff which are there to help you. We arrange eye exams on site with just information from the patient. There is always an optometrist on site, 5 out of 7 days of the week. How I personally help out? Well, to start off, my name is Varun Sharma, and I currently attend Georgian College, the Barrie campus. I am an intern optician at Avenue Optical. We are a small store located at 200 County Court Boulevard. The owner and founder, Vijay Sharma, who was also an MD, a medical doctor. His phone number you can reach him at is 905-454-1277 for any further questions. I would also like to add, he also has an ideal acupuncture clinic. As seen in the picture, an acupuncturist is working on a female patient. Excuse me. I help out by shadowing Vijay. I shadow him from taking PDs, pupil distance measurements, between patients. I also do as he says throughout the store. Clean glasses, make appointments, so on and so forth. What do we do? As a team, we help out patients. We get into their personal space with permission and help them out with any ocular questions. We arrange eye exams on premises, walk-ins or call-in. We fix any eyewear problems ranging from physical to alignments, from broken parts to adjustments, and we answer any questions as well as give advice on how to take further care of them. Health and safety at Avenue Optical. Staying healthy is number one, as always. If you're not healthy, your patients won't be satisfied with you only giving them about 50% because physically you're somewhere else as well as mentally. Be active. Be outgoing, be enthusiastic, don't be rude. Communicate. If you're sick, you tell Vijay. If you have any problems, you ask Vijay. Or you ask the employees around you which have been there longer, just like I do. And most of all, be safe. No matter where you are, you can never be safe, even in an optical store. Health at Avenue Optical. Be healthy yourself, as I already mentioned. If you aren't healthy, you're not going to give 100%. Use hand sanitizer in between patients, or whenever you feel necessary. But with using hand sanitizer, often, you end up getting dry skin. Use lotion. Also, washing hands in between patients or regularly before you eat and before your lunch break and after your lunch break. So you have clean hands when helping a new patient. Covering certain body parts. Make sure you don't catch a cold when weather changes drastically. From snowing one day to sunny and bright the next to raining the next. Be cautious of the weather. Ask questions. Always, no matter what, ask questions. There is no such thing as stupid questions, so just ask. Be alert and be cautious to everything around you. Make sure you know it's safe, and if you don't, ask. What to watch out for? Like any workplace, infections can occur very often, especially when you're an intern optician dealing with people's personal space. You are more touchy towards the face area and the eyes, which are more likely to get infected if you yourself are not clean and sanitary. If I do not use hand sanitizer or wash my hands between patients, I can transfer infections and diseases over to the next, as well as myself, as well as the employees. And this becomes a huge outbreak, which you want to avoid. So next, ocular health. Make sure you are okay yourself. If you have pink eye or any sort of blepharitis, do not show up to work. An example would be me. Excuse me. I showed up to work with a pink eye and had to go home immediately after seeing the doctor and getting a few eye drops. Bacteria can be transferred from anywhere. Touching a surface and touching the person's eye, touching your own clothes to touching the person's eye, fixing glasses, adjusting them to the person's face and needs. If your hands aren't washed, you're going to make them leave with your bacteria on them. And you never know, it might spread or it will spread. If you are sick, stay home and rest. Make sure you are okay, take a sick day. Tools. Make sure you are always know how to use the tools around you. From box cutters to screwdrivers to glass lenses to sharp objects. Even lenses can have sharp edges if not feathered well. Feathering is the process where they eliminate the sharp edges around the glasses, so if something happens to the glasses and the lens breaks out and hits the eye, there will be no damage to the eye dot. And learn how to use the tools and equipment, so just ask. The following graphs you see are infection graphs. They range from diseases to infections, such as global blindness on the left. It talks about what 5 main diseases and infections that cause blindness. And trachoma, in the red, is the #1 preventable eye blindness infection. How do I know? I've done a presentation on it, and I'll get into depth, but it is your rolling of the eyelids inwards. Your eyelashes point inwards instead of outwards. They scratch the cornea, and repeated infections over time lead to blindness. So if it is caught in the beginning, you will not have an infection again, but however, if you're not clean and sanitary, it will happen again. It usually happens in poor countries such as Africa because there is no health care and the water is dirty, so therefore they can't clean themselves and stay sanitary. On the right are corneal scars, infectious keratitis, and other causes that cause blindness and diseases around the world, ocular-wise. This picture I have put up to show you what happens in a daily, an average person's life, how they treat themselves when they see an eye infection. You go to a clinic, you get your optometrist check it out. If it's not good, if it's good, he'll let you go home. If it's not, you go to the hospital, and from there you get therapy. Do you really want to go through that whole cycle when it could have been avoided in the first 2? Stay healthy and stay active and be cautious. Ask questions. So how to stay safe, not only in Avenue Optical, but everywhere else. Knowledge is #1. Know what's around you. No matter what, if it's something you don't like, if you think it's not safe, or anything along those lines, you tell Vijay, or you tell somebody else that will tell Vijay, tell his manager, and so on and so forth. But make sure your message is across. Washing your hands. #1 way to avoid any infection, disease, or bacteria transfer. Using hand sanitizer is a quicker way, it's a quicker method to go between patient to patient to patient when the store is busy. Learning how to use the right tools. If you miss a screwdriver and it hits your finger, you're going to bleed. Therefore, you need your tetanus shots because it is metal, and that can all be avoided by just asking questions. Communicate. If you are not sick and cannot come to work, you let Vijay know, or your supervisor or manager or owner. You ask questions at all times, no matter what. And thank you for listening to my presentation. My name is Varun Sharma, or Varun Sharma, and that is my health and safety presentation. Thank you. This is bibliography. Thank you very much.